terms of the media and delivering information to media outlets around the world. And we're very lucky to have Richard Harris, who is the anaesthetist involved with the care of these children. And I think this case just highlights that sometimes we get presented with a challenge that we've never met before. How do we deal with it? What are the ethics, the morals? How do we apply our conventional medicine that we do every day? And this really highlights that, our thought processes, our decision-making ability. So, Richard, can you hear me?
Yes, I can. Can you guys hear me all right?
Yeah, superb. Welcome, Richard. I'm Alex Rowe, Medical Director for WEM. We've got a big room of people here who are really keen to hear your story. So I'll let you sort of kick off and then we'll just go into sort of questions and answer session. So the floor is yours, Richard.
Terrific. Thank you. So I've been asked to speak for 15 minutes to, I guess, summarise the events of June and July this year when I became involved with the cave rescue in Tambaluan Cave in northern Thailand. So I'm going to try and give a bit of a synopsis. I can easily talk for a couple of hours on this topic, so I'll try and be very succinct and in fact I'm just going to set a little timer here so I don't go over time. So I'm an anaesthetist based in Adelaide in South Australia and work half-time in private practice and half-time with our aeromedical retrieval service in Adelaide. And I guess for pretty much as long as I've been, since I was a medical student, I've also been a very enthusiastic scuba diver, and from the mid-80s became a cave diver, and perhaps for the last 15 to 18 years have been an exploration cave diver going around the world exploring new caves. And obviously as a critical care physician doing sometimes quite deep cave diving, I've become very interested in the physiology of that, and so that's, I guess, just to explain where I've come from. I'm also involved in volunteer cave rescue and cave diving rescue in Australia, and unfortunately up until this point that's really only involved body recoveries, but we've been training quite hard for the last 6 or 7 years to potentially rescue someone through a water-filled section of cave, and we've given a great deal of thought about that, and I've worked with people around the world, at least conceptually, how that might occur. But of course, none of us had ever given any thought to how we might rescue dependent people from a water-filled cave, and certainly hadn't thought that it would be children that we'd be practicing on when this first happened. So I had been following the problem in Thailand with these 12 kids and their coach lost in the cave, and had been in touch with one of the British divers, a guy called Rick Stanton, who's a fireman or retired fireman from, is it Leeds or Leicester? I can't remember actually, but down in the Midlands there. And also a Belgian cave diver, an expat living in Thailand. So I've been talking to these guys over the previous few days, and on the morning of July the 5th, which was 3 days after Rick and John Valanthan, his dive buddy, found the children. Rick rang me in the morning. I was actually in the operating theatre doing a thyroid case. I remember it very clearly, and I took Rick's call, and he asked me if it was possible that I could sedate these children to bring them out through the cave, because basically they had no other thoughts as to how they were going to extricate these kids. My initial response, in fact, I've still got the Facebook Messenger message to him, was that sedation is out of the question. It's impossible to do that safely and dive kids out in an anaesthetised state. But I was happy to come over with my dive buddy Craig Challen, who you saw in the opening slide there, and we could come over and certainly lend them another pair of hands. So basically, that same day we were on a plane to Bangkok, flew overnight, and then the next day a second flight up to Chiang Rai province, which is right up in the northern part of Thailand, right on the border of Myanmar. Actually, our hotel, actually the back of the hotel was on the river, which is the border of Myanmar. So we went over there, and the first problem that I faced as a doctor was that the Australian government, the Department of Foreign Affairs and the Home Affairs, had to organise authority to practice for me in Thailand. And until that piece of paper came through, I was confined to my hotel room and wasn't able to even go up to the cave. But that came through remarkably quickly, which I think in itself is an interesting thing for a lot of Western countries to ponder. You know, if we need a specialist with some particular skill set from overseas, how would we possibly get them registered and into our country, able to practice in our country? I know in Australia, medical registration and immigration policies, all these things are completely prohibitive and would make that almost impossible to happen quickly. But with all credit to the Thai government, they made that happen within several hours, and then Craig and myself could head up to the cave and get a feel for what was going on up there. So the first thing we did was seek out the British dive team. At that stage, there were 4 British divers there. So we met up with them and basically got a situation report from those guys. And the situation was that over the previous few days, the water in the cave had been gradually dropping, and that diving was now possible for the last couple of days in the cave. Whereas when those guys first arrived, it was actually physically impossible to make their way through the strong floodwaters coming out of the cave up towards the children, which is one of the reasons it took so long for divers to get to the kids to find them. The children were high and dry. They were on a very steep mud bank, about 15 metres high, about 45-degree slope that they had to crawl up to get there. Very slippery and wet and difficult to get up there, although maybe not for those little Thai kids. They were very fit little guys, but quite awkward for me to get up. And they were in pretty good shape, actually. They'd had 9 days without food initially, and then subsequently they'd had 3 days of MREs that the British divers had taken in ready-to-eat meals for them. And subsequently, I should say, the conditions in that section of the cave had deteriorated rapidly once the kids had been eating and drinking a lot. There was a lot of human waste now in that section of the cave, so the smell in there was pretty horrific by the time we arrived in there. And so we were faced with this situation where actually the kids were pretty safe and well fed for the time being, but really there was no way to get them out of the cave. And they were about 2.5 kilometres from the entrance into the cave at that point. Probably 1 kilometre of that was flooded in intermittent sections, and then a bit over 1 kilometre was dry cave. And when I say dry, sometimes it was chest deep water, sometimes you were walking along beaches or across rocky sections. But all in all, some fairly difficult terrain to move these kids through. So the options that were being voiced at that stage were basically we could either leave the boys in there until the monsoon rains finished, and that could be up to four months at least. And even when the rain stopped, it might take another month for the water to fall. And in that time, obviously, they could continue to pump water out. They were searching for other entrances above the cave. They were furiously diverting water from some streamways up in the mountains to try and get the water to move away from where it was being entrained into the cave. We could hope that they could be provisioned and survive for 4 months. Having said that, if the rains increased again, which inevitably they were going to because the monsoon hadn't really properly started, then it wouldn't even be possible to dive into the cave again and resupply the kids with food or clean water. So it seemed very unlikely that the kids could survive that period of time. So plan B, which seemed to be necessary, was that we need to bring the kids out and needed to be as soon as possible because of the imminent nature of the rain. And so we toyed with the idea of could we give the kids some diving lessons over the course of a day or two? Could we use full face masks for them to be brought out with so they didn't have to worry about, keeping the regulator, the second stage, in their mouth? But at this stage, the information was that the kids couldn't even swim, let alone dive. And it seemed that they would probably be not in good enough physical shape to do what was probably a 3 to 4 hour journey out of the cave from where they were sitting, and that there was no time to teach them the basics. So really it came down to a plan of needing to decide to sedate or anaesthetize these kids to bring them out. So really the first thing I had to do was, for myself, dive the cave. So Craig and I did a dive to the end of the cave the first full day that we arrived on site. And that was took about 4 to 5 hours, I think, to reach the kids from the entrance to the cave. Fairly high flow still. The British divers had put a very thick climbing rope through the cave so we could pull ourselves along that through the water-filled sections and then wade or walk in the drier sections. And used 3 scuba tanks to get to the end of the cave and back with a good safety margin. So not an enormous amount of gas, and the reason for that being that it was very shallow, even in the flooded sections, a maximum of probably 5 metres deep. Once we arrived at the kids, we managed to scramble up this hill and have a good look at them and confirm that they really did look to be in pretty good shape. A couple of them I could hear coughing. There was a doctor there from the Thai Navy who was able to speak English, and I did a bit of a systematic review of all the kids at that stage to establish if there were any particular health problems. And apart from some minor infections starting on their feet and these couple of kids with early chest infections, they seemed to be in really good shape. And from the point of view of their psychological well-being, that they were exceptional. They were all in really good spirits. They seemed to be, I didn't see a single quivering lip or a tear or any moaning or crying. I can't imagine a bunch of Australian kids being so robust, that's for sure. So they were great, amazing kids. So we left them some more food and we had a bit of a chat with them and told them what we thought might be the plan for the next day. In fact, I'd taken in a recipe, I guess, from which was translated for me by the Thai medical people outside the cave, which basically explained the sequence of events that was going to occur if we managed to get back the next day to start the rescue. So I asked them to fast 6 of the kids, and at that stage, we weren't sure how many we were going to be able to bring out in the first day. It actually turned out to be 4 per day because of the number of full face masks that were suitable that we had. The plan was basically the kids would receive a single tablet of alprazolam, which I thought would be a good idea as an anxiolytic, rapid onset, try and make the whole ordeal a bit less stressful for the kids. We dressed them in a wetsuit. We put a buoyancy device on their chest, strapped a cylinder to their front so that when they were lying face down, they would be that cylinder would act like a bit of a keel and keep them well balanced in the water. And then they would receive an injection in each leg, one of atropine initially, and then an IM dose of ketamine in the other leg. And then once they lost consciousness, we'd put the full face mask on, do some tests with them in the water to make sure that was sealed and, keeping the water out and that they were breathing okay. And then one of the British divers would head off and do the entire journey with the kid, just the diver and one child, all the way to the exit of the diving section of the cave, which was about 2.2 kilometres. All along the way, we had a number of other divers stationed to assist in the dry sections to help transport the kids across different dry sections. We used sked stretchers to do that, and they needed to have some top-ups of their ketamine along the way. Most of the kids got about 2 or 3 top-ups as they exited the cave. And that was pretty much how it went. So we managed the 4 kids on the first day. So 4 British divers took the kids out, and then when the 4th kid was done, I would exit the cave and tell the rest of the kids and the Thai divers that we'd be back tomorrow to repeat the process. And that's how it went over the 3 days of the rescue. I guess there's not time in the 15 minutes to tell you all the little issues that arose, but basically it all went pretty smoothly. There was some, the kids inevitably got pretty cold. The coach actually got the coldest. His core temperature was 29 point something when he emerged, but he warmed up pretty quickly and didn't seem to suffer any adverse effects of that. A few of them had chest X-ray changes once they got to the hospital, and I'm not sure whether that was aspiration or the pre-existing chest infections or a bit of both. None of them suffered any long-term adverse physical outcomes, and clearly demonstrated that this technique, which I thought didn't have a hope in hell of working, to be honest, and expected a very high, a very significant mortality rate amongst these children, proved to be very effective. So one for the books, I suppose. So I guess that's the quickest summary of a pretty intense 4 days of my life that I can give you, and I think there's going to be time for some questions, which I'll be really happy to answer when we're done.
Mike's on. Yeah, thanks, Richard. That is absolutely mind-blowing. You know, you look at the faces in the room here, and it's just incredible. We're all just incredulous, really. I think we shortchanged you a bit, only giving you 15 minutes, but it really is one of the story of the decade. So I'm going to extend this a little bit, so I'm sure there are loads of questions in the room, both from a sort of physiological point of view, a medical point of view, and also a moral and ethical point of view as well. So if we just open up the floor, but if we could make sure we have a microphone before you start asking your question, and then Richard will get to hear it. So yeah, questions.
Hi Richard, thank you. That was a fantastic story. I actually did my elective out with MedStar earlier this year, so it's quite nice to see Richard's face.
Who's that?
It's you really can see. Hello. Hi. So I was just wondering, with the coach, how the technique was changed. Did you sort of sedate him as you sedated the kids, or did you take a different approach for him?
Yeah, so I was hoping to get away without anaesthetising the coach. I thought we'd be able to talk him into being swum out by the Navy SEAL divers. But once the coach saw the other kids going out anaesthetised, and then, you know, the next day would come back and report that it had all gone well, he said, "Oh no, I'm going out the same way, thanks," which I'm sure was a wise decision, because I don't think any of them could have dived out through the cave without panicking and drowning themselves, and almost certainly endangering the rescue diver, which obviously is a no-no in any rescue. The cave in different sections was pretty challenging. It was extremely tight and zero visibility. There were some bad line traps in the cave, which means that, you know, when you're swimming out holding onto the line with one hand, you get to a section that you think, well, a human being can't possibly fit through where the line's going, so you then have to move the line around and find the little hole that you can fit through, and it's just kind of a game of braille in that situation, which is fine when you're by yourself, and as an experienced cave diver, don't forget we do this for fun as well, so that doesn't worry us too much. But of course, when you've got a small child, you know, under your arm as well, that does add a certain degree of difficulty to the exercise. So I don't think any of the kids could have got out alive if they were conscious. So sorry, you were asking about the difference in the technique. So the technique was exactly the same. In fact, the coach was about 60 kilos. I think the biggest kid was 65. The smallest child was 29 kilos. So yeah, we used the same technique for each, and I just divided up the doses into big kid, small kid. Basically, I assumed all the kids would be either 40 or 50 kilos for the induction dose, and I gave a little bit more or a little bit less out of the syringe if I thought that was necessary. But for the lay people, the divers who had to top them up, I very much told them just to base it on whether the kid looked like a big kid or a small kid.
Superb, some good science there. So next question.
Yes, thank you very much, Richard. Pedram Kazemi, Norway and Denmark and everywhere. I have a question for your ketamine usage in anticipation the patients would be hypothermic as well. How did you dose ketamine and atropine? Was it the usual dose? Did you adjust it? And the second question is for future, would any motorized devices be possible to use in this murky waters and with narrow passages, smaller devices to help maybe some future victims?
So I'll answer the second question first. We do use DPVs, dive propulsion vehicles, in bigger caves, but you need pretty clear water to safely use them because they go fairly quick, and if you crash into rocks and things, it can be pretty ugly, and if your head hits something when you're going 50 meters a minute, which is a good speed on those things, I can assure you it really hurts, and you hurt your neck a lot. So in zero vis water and in very tight restricted conditions, you just can't use those kind of devices. But actually the flow of the cave on the way out assisted the exit pretty well, so speed wasn't an issue. And in fact, each day we got a bit quicker. The first day it took about 3 hours to come out, the second day about 2, and the last day about an hour and a half for each kid. So we got a lot quicker. Having said that, the coach was on the third day, so he got cold, I think, in spite of being efficient. And I don't know why his temperature was so much worse than all the other kids, who were, for the most part, in the sort of 32 to 34 range, with a few above 35, but a lot of them were in that 33, 34 range. So, look, I was convinced that these kids were going to either drown because their face mask would fill up, or their airway would obstruct because their head would flop forward and the divers wouldn't really know how to look after their airway properly. Or if they didn't die of one of those things, that they would almost certainly die of hypothermia. And for all the anaesthetists in the audience, we all know that as soon as you induce anaesthesia in someone, their core temperature drops quite rapidly. And so I could only imagine that with an ill-fitting wetsuit in 20-degree water for 3 hours in an anaesthetised child, well, I couldn't even begin to guess how bad that was going to be for their core temperature. And I really did expect the worst for that. They're also a bit malnourished. They were all skinny, fit kids anyway, but they'd all lost a few kilos on top of that, and they all looked pretty scrawny. So, look, I've got to be honest, I was completely making up the dose as I went along. I just decided on a standard 5 milligrams per kilo IM dose because I was more concerned about one of the rescue divers being killed by a child who was coming to underwater and thrashing around and drowning the diver. So I had to give the priority to the rescuers, not the patients, I guess. So I thought I want a solid dose, and we can review it on the second day if it turns out it was a bit much on the first day. But actually, it seemed pretty spot on, to be honest. And then the top-up doses were 2.5 milligrams per kilo. But of course, this was all fairly rough because we had to make some estimates about the kids' size.
Thank you. Next question.
Hi, and thank you for sharing such an inspiring story. I just had two questions, really. One was, you have alluded to that there were some non-medically trained people giving the second injection, third injections. Did you have any medical personnel in the caves between yourself and the exit who could perform any emergency resuscitation if necessary? And secondly, to what extent did the children's parents and families know of the risks that were being undertaken, and how did you approach that ethical dilemma?
I'm afraid the answers to all your questions are very bad, and you're possibly not going to be happy with them. So there were no other divers in the cave who had any medical expertise apart from my buddy Craig, who's a vet and has probably given more IM ketamine than I ever will. But only furry four-legged friends, not children. So I gave a basic lesson on anaesthesia 101 to all the cave divers before we set out, and they all practiced giving an injection into a water bottle, and that was the extent of their anaesthetic practical training. And I pretty much did everything I could to allay their fears to the point where they would be capable of carrying out the plan. So I probably, it's fair to say, skipped over the risks pretty comprehensively, and told them, basically just stick the injection in the leg, try for the lateral outside, try for the lateral anterior quarter of the thigh, but it doesn't really matter where you get it. As long as you don't squirt it into the wetsuit, it will work. Just stick it in and squirt the stuff in, and everything will be fine. I reassured them that it's very hard to overdose people with ketamine, and that their airway would be fine, their breathing would be fine, their blood pressure would be fine, and nothing can possibly go wrong. And you know what? These guys are extraordinarily practical, tough, pragmatic people, and I'm sure they saw right through all my lies, but they were happy to be reassured so that they were able to crack on with the job that needed to be done. They all knew that this was an exceptionally high-risk operation, and the children basically had no chance of survival if we left them, and pretty much a poor chance of survival if we carried out this plan. I didn't believe that any of the first few children would survive, and I assumed that after the first couple drowned that I would have to probably walk away from the plan, thinking that I wouldn't be able to continue. So as I said, no one was more surprised than me when it worked on the first day and then the second. In terms of the parents and what you'd call informed consent, I still have not seen the parents at all. Certainly didn't get a chance to talk to them about the plan beforehand. Thailand's military leadership is pretty paternalistic, and I suspect there was no informed risk discussion with the parents. I think the parents were just told that we've come up with a plan, it's the only plan we've got, and that's what's going to happen. And that given the culture that they live in, they were probably pretty accepting of that. And certainly the kids were. And the Thai Navy divers in the cave, when I explained what the plan was, they all agreed to it immediately and said, yep, I seemed to get their buy-in straight away. So, yeah, I can't say I felt comfortable with any of it, but I wasn't really offered the opportunity to talk to any of the parents, and it was probably for the best, I think, from my point of view.
Great stuff, thank you. Got a question from Tim at the front here.
Thank you very much. It's great to hear from you. If it had gone wrong, where did culpability and responsibility lie? What did your defence union think?
So on the end of the first rescue day, the Department of Foreign Affairs minder who had been assigned to us came up to me and said, "Oh, Harry, I didn't really mention this, but in the interest of full disclosure, I should tell you that if something goes wrong and one of these kids dies, it's not impossible that you could end up in the Thai judicial system." I thought, oh, what does that mean? That doesn't sound good. And I said, does that mean I could go to prison? He said, yes, basically. So they were working on getting diplomatic immunity for myself in particular, but for all for Craig as well. But that didn't come through till the morning of the second rescue day. So, my bandwidth just didn't have space to deal with that as an issue as well. So I just said that, look, that's fine. We'll just carry on and hope for the best, obviously. So I think had things gone badly, it probably would have gone quite badly for us as well. And maybe I was a bit naive or not really, I just didn't have time to think about the consequences from a personal or professional point of view. But clearly, the more I've thought about that subsequently, the happier I am that things went the way they did, because I don't think I really want to, I don't think I'd be talking to conferences like this with a smile on my face. I think, I'd be feeling pretty sad and sorry for myself if the kids had all died. Obviously, I wouldn't be all that happy to be talking about it.
Thank you. So interesting to listen to this, and I just want to ask you about the casualty that I heard of. There was a Navy SEAL, Thai Navy SEAL operative that died, wasn't it? And was that before or after you arrived? And what went wrong there?
Yeah, so when I was walking across the aero bridge from the aircraft in Chiang Rai, I paused and looked out the window of the aero bridge, and they were pushing. There was a big military parade on the tarmac. They were pushing a coffin into the back of a Thai Navy aircraft, and that was the body of Saman Gunan, who was a retired Navy SEAL who worked at the airport and came back, like many people did, to help with the rescue. So he was diving in the first proper sump in the cave, which was actually the very tight, restrictive, difficult and dangerous dive out of the 8 or 9 different diving sections. And they were trying to feed an oxygen umbilical, basically a commercial diving umbilical, but they were going to pump oxygen all the way to the end of the cave, which was 2.5 kilometres from where they were trying to feed it in. So it was a plan that was never going to work, particularly given the terrain, the underwater terrain, once I'd seen that. And I think he just ran out of air. Basically, they pulled his body out and attempted to resuscitate him for about an hour and were unsuccessful. So he had drowned, but the exact mechanism, I don't think anyone will know, because it would have been zero visibility. And, as competent as elite combat divers like him are, there is no substitute for specific cave training, which is why around the world in any cave diving recovery or rescue, it's critically important that trained cave divers are involved, and why after Saman drowned, all the military and police divers were pulled back to the dive base, which was Chamber 3, and only the civilian cave divers were allowed to sort of push on from that point forwards. So it's probably just a matter of simple problem with gas management, or in the zero visibility, not having redundant gas supplies, or knowing how to deal with loss of gas in that setting.
Richard, that's amazing. We'll take one more question, I think, if that's all right.
Hi, thanks for a very interesting talk. Sounds like a very courageous rescue, both from a technical and medical perspective. How did you weigh up the risks of the evacuation you've talked about versus the risk of leaving the kids where they were until conditions improved? And to what extent may you or any other member of the team been put under political pressure to expedite some sort of action?
Well, in fact, the reverse was true. We had a lot of trouble getting the Thai leadership to commit to the rescue plan. I was encouraged by the Australian government not to pressure the locals into committing to any particular plan, but just to present, the options as I saw them, and for the rescue plan to present my plan of the sedative drugs and the techniques that we would use, and basically saying that if we go down this path, this is the way I would recommend that we do it. But there are so many layers within the command and control structure in the Thai military, and I think the consequences for them of making a poor decision are quite drastic, potentially, for not just their career but their lives. And so it was very hard for them to commit to a decision. They were very much more of the mindset, I think, that it's safer for them to not make a decision. In other words, continue with the pumping and the water diversion and all this kind of stuff, rather than to commit to some affirmative action that might end badly. But you can imagine from the way I was talking about my view of the likely success of the rescue plan that we were looking for any other option to avoid doing what we did. But by thrashing it out time and time again with the British divers, the European divers that were there, and particularly the American pararescue group, who were excellent at kind of summarising and bringing a big picture understanding to us, it was really clear from all these very long discussions late into the night that there was no chance of survival if we decided to leave the kids there. For example, they had about a week of food with them, and once the rain started, we wouldn't be able to provision them at all. They wouldn't be able to get any more food into there for a month or two. We didn't know. So there's just no way they could survive. So really, it was the worst. It was the best worst plan, I guess, is the answer. And that's what we did.
Brilliant. Richard, thank you so much for joining us. It's been absolutely incredible to hear your story, and I'm sure we could ask questions for the rest of the day. But thank you so much. So a big hand to Richard for joining us.